What are the main benefits of using the map in practice at different levels of the service?
So one of the main benefits from my perspective is that it makes it very clear as to who does which bit of the pathway in terms of service provision, and then it's easier as a commissioner to commission the different bits of the pathway. But the map of medicine also allows a whole pathway approach, so you can actually form an integrated care provision and allow the patient to follow a whole pathway without falling through the gaps. And that's really important as a commissioner, to know that your patients have the very best care that they can have.
Mm-hmm. And in support of that, map medicine is, for the first time, an evidence-based pathway which is being nationally referenced and maintained, and it will guarantee the standard of care and guarantee the quality of care, so that anybody who follows the pathway will reach that standard. So that's the first important thing that comes out of map medicine. In developing the pathway, we will find it will bring the primary and secondary care clinicians together because they design the pathway. We can look at local issues and localizing the pathway, like we can put the details on of local clinics, local services, forms that are used, and it will make the patient journey for any particular condition seamless from primary to secondary care and back again. So this transference of care for the patient is guaranteed of that quality in the map of medicine.
And I think the other important thing is that the map of medicine pathway can actually be printed and can be handed to the patient. So the patient knows exactly where they are on the pathway, which bits of their treatment have been completed, and they can then ask questions of their clinical team in terms of other bits of the pathway. So they feel fully in control as they go along that patient journey.
Right.
And I think it's a really good tool that the map provides to patients.
And the other element is in primary care. I know with extended access there is a lot more that the primary care is now available to the patient. But if you look at the out of hours segment, where there was some compromise of quality in some areas, we can guarantee the same quality because they're following the same map of medicine pathway right across 24 hours. So it really standardizes the quality and level of care.
How does the map encourage joint working between clinicians?
What we have done locally in the Wirral is, apart from using the map as a commissioning tool, which I'll ask Cathy to make comments on, what we've done is we have looked at each map for a particular condition and got clinician leads from primary and secondary cares to localize that map for the Wirral. For example, take any pathway that we have developed for, say, the age-related macular degeneration or the continence for male-female continence pathways. So what we've done is we looked at these pathways, the national pathway that exists, and added on all the local flavor to it. Now, working together with clinicians across primary and secondary care, this has designed something that is very local. It's also brought the clinical team together. Now, once the pathway has been designed, what we do is we send this out to every clinician in Wirral. That's all doctors, nurses in primary and secondary care have a look at it, and they put their comments in. And then when it comes back, we then take it to PEC to sign off the pathway, to give it the governance. So I feel that this has been an enormous tool to bring together clinicians at all levels to design and then to implement it.
And I think the thing that the pathway does in terms of commissioning is it identifies the gaps in the service provision. So we know the national best practice because of the pathway, and we can identify those gaps, and then we can commission services into the gaps, so we start to have a seamless service.
Are patients getting a better experience of health services after using the map?
Yes, definitely. So there's no doubt about it, because previously we'd redesign a service and we'd provide the service and we would follow some guidelines that were existing. But now not only are we having a guideline which is referenced, evidence-based, which can stand up to any scrutiny, we've also added the local flavour to it by localizing the pathway, and we've got the primary and secondary care clinicians working to the same pathway, so we standardized that level of care. So it's been of enormous benefit to the patient.
How can all health professionals benefit from the map?
There are a variety of ways. Currently we have 65% of GPs on the Wirral have signed up to the map, and there is a target by 31st of March next year to have 100%. We have 50 consultants from our acute providers also use the map, and we have 500 healthcare professionals, that's both managers, nurses, midwives, allied health professionals that use the map. And they use it not only to redesign pathways and work with the service redesign teams, but they also use it for e-learning and educational training purposes.
Yes, and so if you think about it with this plethora of things around, because we promoted the map as a tool, so this is why the clinicians have taken it on so actively, because they find it extremely beneficial for their personal development, for continuous learning, and also to provide a quality patient care. So this is quite important, and that's why we have had such terrific engagement, because the fact we have delivered on so many map of medicine pathways is because we've had engagement at that level, and that's been very crucial and important. So age-related macular degeneration is one of the examples where it's made a big difference, but there are loads like that, something simple as continence or COPD service, or recently we've just designed an integrated TB pathway. So there's loads of examples of where joint working across primary and secondary care has delivered the results through map of medicine.
But I think the other thing that it does, it also allows a common language between managers and the clinical staff, because now there is a common language that is used and it's all around the map, so you're not trying to understand each other. It's much easier because it is about one pathway.
And how has this made the Commissioner's job? Has it made it easier?
I think it has. Firstly, because it's identified the gaps in the service, so we know where we're lacking service provision and we need to be commissioning into that gap. But also it's allowed us to look at the PCT strategic plan, identify our 10 top health inequalities and life expectancy issues on the Wirral, and then commission pathways up against those 10 high categories. And we have, as Shyamal has said, we have pathways on COPD. We've just produced an end-of-life pathway with a totally integrated care pathway for cancer and palliative care using the map of medicine. And this is a gold standard pathway that's been produced. So it's much easier for us as commissioners because it's removed commissioning out of just numbers and finance, and it's moved it along into service redesign and putting patient engagement at the heart of what a commissioner does. And that's really what commissioning is about.
And apart from it being used as a commissioning tool, we found the map of medicine as an excellent governance tool. So basically, once we've designed the map of medicine pathway across the whole health community, there's governance guaranteed in primary care and also in the acute sector and the secondary care. So which is why all pathways are going through PEC, so that it is signed off through the PEC by the PCT. So it's been an excellent tool for commissioning and for governance.
To access the map, which is free to NHS staff in England and Wales, go to www.mapofmedicine.com.